It gives me great pleasure now to introduce our second keynote speaker, Mr. Ed Fitzgerald, who's currently working with the Global Healthcare Practice team in KPMG. And one of the reasons why I was very keen to ask Ed to speak to us today was an FMLM conference in Liverpool a few years ago, where one of Ed's colleagues, Mark Britnell, talked. And something that Mark said has stuck with me ever since, and it was that in KPMG, when the annual objectives are set for each individual and then the appraisal performance review happens at the end of the year, the outcomes are important, but more important is the values and behaviours that are exhibited in achieving those outcomes. And as you will all know, that's something that's very dear to my heart, that we exhibit to each other and everybody that we interface with, the values and behaviours that we expect. And in this time of change, it's a time that sometimes people feel a bit unsettling. It can be something that causes people's values and certainly their behaviours to not be those that we would want to see. But it's something that I feel really strongly we need to model and expect of others. So, Ed, I'm very grateful to you. The floor is yours.
Well, thank you, Nigel. It's an absolute pleasure to be here with you this morning, and thank you very much for the opportunity to talk to you. I was saying earlier, I hope I'm not walking into too much of a lion's den. Some of what I'm going to say feels like I'm lighting the torch paper slightly, but that's perhaps because of the perspective that I'm coming from. I had 12 years in clinical practice before taking up this current role, and I'm very fortunate now to be able to look at a lot of different health systems around the world and look into the bonnet and see how they work. And that bird's eye perspective has given me a lot of time to reflect and look back on our own medical profession in the UK and perhaps critique it a bit more than I would have been comfortable to do myself when I was still in clinical practice. So as I say, I hope I'm not lighting the torch paper too much with what I'm going to say, and I should add that this is as much personal opinion as it is some of our reflections and thought leadership that I'll share with you. So a bit about my background and why I'm here and why I'm talking to you today. As I mentioned, we're very fortunate to have a very wide global healthcare network, and most health systems and most healthcare providers around the world, not just the NHS, are very parochial in their nature. Quite often, you don't know what's happening in other healthcare systems, in other counties at other ends of the country, let alone in what's happening globally. We're quite poor, I think, at sharing best practice and knowledge. And it's a busman's holiday for me, a real privilege, as I say, to be able to travel to many of these countries and have a look at what's happening and be able to share best practice. But there's one common golden thread that runs right through all of this around the world. Wherever we go, whoever we speak to, it's always fundamentally workforce that is the biggest problem that people are facing right now at the moment. Now, the size of the problem, the scale of the problem that we're dealing with is absolutely huge, and obviously we're very acutely aware of this in the United Kingdom at the moment, and there are some particular points and reasons and politics that I won't delve into right now in detail, but the wider point here internationally is if you hold a mirror up, the workforce problem is one that's shared all around the world, and there's an important point that comes out of this. First of all, the huge shortage that we're facing, it's monumental, and we're sleepwalking towards it at the moment. But because the rest of the world is facing this as well, it's not going to be easy, as much as it has been in the past, to buy our way out of trouble, or certainly for other countries to buy their way out of trouble by pulling in healthcare staff. We need to think about how we work differently. And the usual response to the scale of this problem is we need more workers, we need more people. And there's no doubt that we do need more healthcare workforce internationally, not just in the United Kingdom. But we also need to think differently about how we work and the nature of the work that's delivered in healthcare. And that's the really important point that I want to focus on today. Our hypothesis is that a large proportion of that shortage can be delivered by working differently. So, contentious point number one is that, yes, everybody talks about the numbers, but the real challenge behind this at a big scale is productivity. That's the real challenge that we're facing. And productivity, I sort of see lots of times these days, transitioning from clinical practice, you come across lots of words like this that kind of feel like dirty words when you're going back and talking about them clinically. But productivity, really, we're talking about what we do for the input that we've got. And that sounds like just making people work harder, but it isn't. It's about that working smarter point. We are not going to be able to get enough people into healthcare in the short term, and in the long term, we're probably at a global level not going to be able to afford to pay people enough to encourage them to come in. Now that sounds kind of, dismal, painting quite a dark and bleak view of things. But I think there's, a challenge that we're facing that we need to look at. This sustainability is a real problem, and if you look at other sectors, and I'm going to come on and reflect a little bit on KPMG in a moment. We've done a lot over recent decades to change technocratic parts of healthcare. We've looked at service delivery. We've got a big push on prevention. The 10-year plan is going to push a lot of these much further forward. But what we've been really tough to grapple with in healthcare, both in the UK and overseas, is actually that nub of what the workforce does and how it's managed. And there's obviously a focus on that at the moment, with the report due out later this year. But we're at a point 70 years after the foundation of the NHS where if you were rebuilding a healthcare workforce now, you certainly wouldn't have designed it in the way that it was. And actually that's the same picture around the world. We haven't really tackled the thorny issue of healthcare itself. So we need to work smarter. And there's lots of different ways we can do that. Everybody is talking about technology at the moment and how we're able to play that in, and certainly that's going to play an important role. I feel personally that that's a little bit of the bright, shiny object. And actually, we need to get our house in order from some more basic points that I'll come on to in a moment. One of those basic points is really about thinking about how we manage and how we actively engage with our workforce in order to push that productivity and get the most out of them. And in that particular area, healthcare is particularly behind as a workforce area compared to other market sectors. Now, our research has previously shown that if you look at the best healthcare providers around the world, if you look at the likes of Buurtzorg, Aravind, etc., it's possible to drive out about 15% efficiencies through smarter workforce practices, and that can go a long way to addressing some of the workforce crisis that we're facing at the moment. Now, that doesn't help you on a Friday night if you haven't got an FY2 to put into a rota that weekend, but if you step back and look at a provider level or a system level, it does change the nature of the work. And it's a bit of a trade-off. At the moment, so much of our emphasis has been on productivity and efficiencies in the UK, and that's led to a decrease in really the attractiveness and, in some cases, the quality of what's being delivered. And it's difficult to get that balance right, and it's even more difficult to deliver the paradox of increased productivity and the attractiveness of the work and the quality of what's being delivered. But that's the ultimate goal we should strive for, and many organisations that we've looked at have achieved that. It has been done. And if we can lift providers and health systems up to the level of what is not theory, what is already being delivered, there is a huge potential achievement to be delivered. So how do they do that? Well, our report, Value Walks, it was named Value Walks because the old adage that people typically talk about cost walks, that the workforce is the greatest cost. And we wanted to turn that around on its head because really workforce delivers the greatest value is the way we should look at it, and value walks. But there are 5 habits of good providers, which I'll just run through briefly now to think about. Number 1 is, and I don't think anywhere is good at this, I don't think anywhere is perfect at it, but I think it's a particular weakness that we face, is looking at whether a provider has actually properly looked at what is value for patients. And value is one of those other kind of management dirty word that comes out. What I mean by that is delivering what the patient wants, what's good for a patient. How many organisations have really truly defined that? Have they set their strategy around delivering that? Have they built an incentive structure to incentivise that? Have they got a culture that can help support that within their organisation? Successful organisations have addressed that. Empowered professionals. Touched on that, talking about continuous improvement a little bit earlier on, and I'm going to go into that a bit more in a moment. But how many of us really work in organisations that have empowered us to solve problems and motivated us? It's a really strong tool for staff engagement. Many organisations are struggling with task and process redesign at the moment. Getting that right can really strengthen the workforce, but it also changes the nature of the work itself and drives out efficiencies. Steering on outcomes, I think the UK is actually generally good at this, along with the Nordic countries. We've been very good at measuring outcomes that matter and feeding those back into the work that's performed and delivered. And what I'll concentrate on in a moment is around active staff management. I much prefer that term, active staff management, to performance management. It sounds a whole lot less threatening. But this is what healthcare really needs to play catch up on, because I really don't think I've seen many organisations that are actually able to truly actively manage their staff and the work that they're doing, and particularly the clinical workforce. So let's play a game for 1 minute before I go on. Really interested to hear what you think. Put your hand up if you think you work for an organisation that has really nailed what patients consider as value and then built a strategy, incentivised it, and have an organisational culture that supports that. Put your hand up if you think you work in an organisation that's got that absolutely sorted. That is quite dramatic. Okay, so point 2, is anybody working in an organisation that's actually rolled out continuous improvement, that is applying that methodology? You can see 3, 4, 5 hands up. Yeah, a few more. Okay, that's good. I was in Singapore 2 weeks ago. The majority of public hospitals have been doing that for a decade, just to put in context where we are in the UK on that one. I'd hope for a better answer on this next question. Who's working in an organisation that's actually really thought about the tasks being delivered and started in some way redesigning the processes to actually try and achieve a better way of working, a better integration? Okay, a lot more hands going up. I'm pleased about that. Who really thinks they work in an organisation where they're getting, I'm not going to say real time because I'm not going to hope for that much, but who thinks they're getting, perhaps regular monthly meaningful outcomes fed back to them about the work that they're doing in their department or themselves? A smattering of hands. And finally, who thinks they are truly getting a fair, solid, regular performance appraisal in the work that they're doing with meaningful support and input into that? Not much, okay. I have to say, that's actually far worse than I anticipated, but in a way I'm glad, because the rest of this presentation would be very short if you put all your hands up for all the rest of it. So that really encapsulates the value that I'm talking about. We are not getting the most out of our own workforce. We're not empowering them to deliver value, because how few of us are actually really achieving any of these points that have been proven to add that extra onto what we can do. Now, a bit of personal reflection here. Some of you might recognise this. This is the Intercollegiate Surgical Curriculum Programme. This was my life for 12 years of filling in all of my forms, my appraisal, my feedback. But it was interesting to go back and reflect on this. I worked in 8 hospitals across Yorkshire, Nottinghamshire, Oxford, and most latterly London. 12 years in clinical practice. How often do you think during my annual appraisals, at any point, any of this linked to the objectives of that hospital that I was working in at that point? The objectives of what that organisation was trying to achieve, maybe perhaps the department at times, but never in 12 years the organisation that I worked for. And from that, never really some of the wider points of what the NHS was striving for either. And I think looking back on that now, I find it really hard to believe that there's such a big disconnect, because the potential of aligning that is absolutely also huge. It follows really to me now, it's axiomatic that if you're being appraised, if you're being actively managed, then you should be working towards what your organisation is working towards. Otherwise, there's a tremendous disconnect. So, how does that relate to healthcare? These points are actually specifically academic points that have been flagged up from looking at healthcare systems and providers and what the opportunities are around this. But to be honest, many of these points could be translated to any other organisation, I feel. There are perhaps some nuances that you can read here. You've recognised them, I'm sure, from some of your own organisations. We do have a preponderance of focusing on indicators that perhaps are not the most meaningful or useful in terms of being able to manage people. We're perhaps rather narrow in what we actually look at, I think, in healthcare sometimes. And my goodness me, we are certainly short-term in the case of a lot of organisations, and to the detriment of the long-term, sadly. And is that chicken and egg? Is that hoisted upon the health service at the moment? Perhaps a little bit so. I mentioned the kind of parochial nature of a lot of healthcare organisations and systems, and I think that does lead to complacency, because we don't get the opportunity to see what's happening in good organisations elsewhere. We're working in our silos, be that in our healthcare provider or be that in our health system. And I think there's a lot to be learnt from other organisations and health systems around that. We hear about misrepresentation of gaming or data, and I'd like to think that it's less common perhaps than it might be in some other areas or industries. But certainly misinterpretation is much more common through no malice or intent, but understanding what the data shows and being able to use that to properly, actively manage a workforce is more complicated than it might first appear. And I like ossification because I think that is particularly applicable to many settings in healthcare, an organisational paralysis due to the rigidity of management. I think the culture needs to change. Now, a lot of people say, okay, in the current climate, how can we do this? Can we develop a way of doing this? Can it be done in healthcare? And the answer is yes, it can. Some of the organisations that we've looked at internationally are already doing this. The problem is, I mentioned already, that workforce is something that's often not tackled head-on. It's not, thorny nettle isn't grasped as it should be. And actually that's because I think within the dynamic of healthcare organisations, the medical workforce is very powerful. Many managers don't wish to necessarily challenge that. There is an adversarial nature. There is perhaps a lack of trust. But ultimately, there's a challenge to the autonomy of the practicing clinicians within this, which is potentially threatened by more active management of their roles. But we can look at what other organisations have done already and learn from that, and Virginia Mason is perhaps one of the key organisations. They acknowledged this right at the start when they were looking to try and build on and develop their continuous improvement work, because I do think these things go glove in hand. They revisited what was the kind of unwritten accepted tenet of physicians working for Virginia Mason. They looked at what the organisation's responsibilities were to them, but also what the physician's responsibilities were to the organisation. And this was done in a very open, iterative fashion. Clinicians and managers and executive board went away to discuss this over quite a period of time to develop this new way of working, this new pact, if you will, between the physicians and the hospital trust about what they were going to deliver and what the organisation was going to deliver for them. And it's been very successful. And it was an underpinning part of them delivering their continuous improvement work. So this can be done, and there are good examples out there that we can learn from. Now, I mentioned continuous improvement already, and it was mentioned earlier this morning. I think these points go together in a conversation that can't be pulled apart. And Virginia Mason found that because if you're looking to actually manage your workforce, to align your organisational objectives with what your frontline staff are delivering, if you're going to build a culture of continuous improvement, then there has to be engagement and accountability within that. And how do you get that if you haven't got a system for actively managing your frontline workforce? So we've got a report coming out in a few months that I've just finished writing. We've interviewed a number of world-leading hospitals around that you'll recognise the names of some of them. All of them are adopted and delivering continuous improvement very successfully. All of them have developed improved ways of working with their frontline staff to enable this and to facilitate it. And what have we found? Well, I mean, we found one key point is that essentially you have to put your hospital objectives in a triangle. I think is one of my take-home messages from all of the organisations that I've spoken to. But to give an international perspective, how do you articulate the value, that first point, articulate the value of what you want to deliver in your organisation that very few people appear to work in an organisation that's done that? How do you then communicate that to all levels of your workforce? You can articulate and develop that strategy at a board level, but if it sits there and doesn't reach your front line, you're never going to deliver your organisation's objectives that you want to do. So communicating right through the organisation is critical importance, and people have put it to me that continuous improvement is really just a tool to connect people, and I think I would agree with that to some extent, because without that alignment, you won't get the good that it can deliver. So an international perspective, Azala based over in the Netherlands, patient value is right at the top of their pyramid of what they're setting out to deliver. They want high quality service, they want it to be safe, and they want good quality care outcomes, and everything else underpins that. They've stated very clearly they want to be the top 3 organisation in the Netherlands for their heart centre, mother and child, and for oncology. and everything else flows out from that. St Mary's is a small hospital in Canada. It might be a small hospital, but it regularly achieves some of the best clinical care outcomes in the whole of Canada. The hospital standardised mortality rate has been the lowest in Canada. We've supported their continuous improvement journey for a number of years, and they've articulated their ambitions perhaps more clearly with some very clear objectives. But both of these organisations share in common that their staff are then held accountable against these, and their objectives are shared and aligned, because without that, how could you possibly hope to achieve them? So getting that performance management, active management, better term, in place, without that, you can't deliver this. So this requires a new relationship between the frontline clinical workforce and the management and the board. And I think it's interesting to reflect on how I might achieve that and whether that could be achieved in the UK in the current climate. And my challenge would be that actually it's a greater risk not to achieve it. But these are some of the points that we would think about that are reported in the literature when it comes to that. Knowledge and understanding of organisational goals. So it's really interesting. I mentioned earlier, in my 12 years, I'm not quite sure any of the hospitals I ever worked at were the organisational goals ever articulated to me, or at least not in a way that made any impression or that I remembered. Survey looking at the healthcare workforce in Australia. I don't know the figure for the UK, but judging from the show of hands earlier, it's not great. In Australia, a survey showed that 70% of clinicians had no idea of their organisation's overarching objectives. So that's the communication point. It has to be clearly understood and cascaded down throughout the organisation. And going back to my goals, my objectives, my performance management, the organisation has its clear KPMG story of what it wants to achieve. The global head of markets then sets the objectives for my boss, for Mark Britnell. I then set my objectives in order to help the global chairman, Mark Britnell, achieve them. So there is a very clear cascading down and communication, a very clear linkage between the organisational objectives that goes right down through the hierarchy of the organisation. The organisation goals should be appropriate and clear-cut. That's much easier to do in a global corporate. I think in a hospital organisation, it's perfectly possible that you could spend a lot of time communicating goals and cascading those down, but if your frontline staff don't agree with them, or don't think they're appropriate, then you're never going to get the buy-in, and you're never going to get them really, truly helping deliver them. Effective organisational and administrative support requires an investment, and that's something that's certainly going to be challenging in the current setting in the UK, and it's something I think we've managed to handle very well in our organisation, and I'll come on to some of the points around what that actually involves in a moment. Willingness to engage on the parts of the individual, and this is perhaps partly where your buy-in to the organisational objective comes in, your incentivisation to do so, the working environment that you're in and the team that you're in and their ability to engage and influence with that. If you're empowered as an individual in a continuous improvement environment to actually make a change, then staff will be much more engaged and able to do so. And we mentioned the performance metrics already. Again, a more sticky point, I think, in healthcare about picking what those are. And there are very few health systems, I think, internationally, UK and Nordics, as I mentioned, being one of them, that have actually got a process in place and have really thought about what the right metrics are that individuals can then be held accountable against. And I save till last what I think is perhaps the most fundamental point and perhaps one of the greatest challenges that we face in adopting something similar in the NHS at the moment is about the trust between management and clinicians. Because without that trust, active management isn't going to really be successful and be delivered. And I think a degree of paranoia, suspicion, perhaps, that exists in some quarters, in some organisations, in some departments at the moment, is a major hindrance to that. My challenge back would be that doesn't change by standing still, and by having something to work through and work around enables those conversations and those connections to develop in order to build trust. But shying away from doing this because the trust is absent is perhaps the knee-jerk response. I'd argue it's not the appropriate one. So I'll finish with some final points to reflect on, and I'm very happy to take any questions after that. I think to go back to where we started, we have to work smarter to get more out of the healthcare workforce. And as you all demonstrated with your show of hands, there is a huge opportunity that we're missing at the moment within the NHS for really helping pick up on this and deliver. And there's a burning platform for us to do so, not just at an organisational level, not just at a departmental level, but at an international level, because the changing nature of the global healthcare workforce and the crisis that's already upon us and is certainly only going to get worse in the medium term means that we can't neglect this area any longer. We need to engage and we need to change. That involves cultural change, which is obviously one of the most difficult parts to really deliver on with any change process. But it's not change just on the part of clinicians and the frontline staff themselves. It's change in the organisation too. It's about being transparent with what the objectives are for an organisation, but also how those have been achieved. It's about changing the culture of clinical engagement in helping set those, and patient involvement too. And it's about leaders acting the values that they deliver, like my director did to me when I first started at KPMG. That's a fundamental cultural change. You have to own it. New skills is very important because actually to do performance management well, to actively manage your staff, is different skills to appraisal. To be able to do that in a supported environment, to be able to interpret the metrics correctly, to have the resource to be able to do that in continuous fashion, none of that will work if staff aren't able, trained to do that well and to deliver. It becomes a meaningless process. In fact, it could even become a process that hinders rather than helps. And finally, personal development. This is one of the real strengths, I think, of the organisation where I'm coming from at the moment. I mentioned earlier that I'm resourced and supported in what I do. If performance management assumes that you're going to develop the individual, and it's been well shown in the literature that if performance management concentrates on the negative, what requires improvement, it actually negatively impacts on an individual's performance. But what's worse still is if you highlight that and give someone no means to change. There is no training in place to help them improve, to help them develop, to help them educate. Then you're really setting someone up to fail. And we're very fortunate that we have our internal business school that helps us develop our soft skills, our core consulting skills, our communication, our client work, so that you are being developed within a safe environment, that you can take these courses, that the ability is there to go away and improve yourself, and it's not seen as a negative, it's seen as a positive personal development. That will be a real challenge for NHS and organisations as to how they build that in. I think my final point is that I said that I hope I'm not lighting the touch paper at the start, but certainly I think a lot of what I've said could be construed as criticism. And I think the positive point that I really have taken home myself over the last 3 years in this role, I'm very fortunate to spend a lot of time travelling and looking overseas. Last week I was in the Netherlands, the week before I was in South Africa, the week before that I was in Singapore. A universal truth from all of the health systems that I visit internationally is the respect with which they hold the National Health Service. It's really quite amazing to see and to witness. Overseas countries really look to us for healthcare leadership. I was just reading a report the other evening in preparation for this talk from the Australian government that did an in-depth analysis of how the UK is currently developing and pushing forward appraisals, really flagged the UK as a world leader in this area. And I think, yes, we can be somewhat parochial in health systems, but I think it is important that we all realise that for all the room we have for improvement, we are already well ahead of the rest of the world in a lot of this area. Thank you very much.